Good afternoon, good morning, good evening, wherever you are joining us from around the world. Thank you for joining us. We're very excited about the session today. We've talked a lot about COVID. Nobody in the world has been insulated from what has been happening over the past 20 months now. And as much as we talk about the virus, we talk about the vaccines, possibly even the need for boosters, one of the big topics, and an important one, is how information itself is transmitted, how it's verified, and what to do about misinformation. Wikipedia has emerged as one of the most important sources of information for millions of people around the globe during this pandemic. It's often one of the first places they search. So this session today is going to bring together one of the leading Wikipedians documenting COVID-19 alongside leading representatives in the global health community and the news media to discuss the lessons learned from this past year and how to meet the growing need for trustworthy knowledge, not just information, but knowledge, contextualized information that is of value to people in their own lives. We're going to explore how different stakeholders have worked to try and deter misinformation and disinformation, and we're going to describe the difference between these two things. We're also going to talk about a first of its kind collaboration between the Wikimedia Foundation, Wikipedia volunteers, and the World Health Organization, highlighting new approaches that are now necessary and being taken by journalists, public health experts, and major websites like Wikipedia to elevate accurate information. So I could not be more excited to join this panel, to moderate this panel. We have a lot of interesting things to discuss. And I think the way that we're going to do this is we're going to have each of our panelists just spend about a minute introducing themselves, talking a little bit about their own experience, and then we'll get to a moderated discussion. We want you to also submit your questions, which you can do at any point during the chat. So without further ado, let me introduce you to our first panelist, Dr. Julio Frank. He's president of the University of Miami. He's Mexico's former Minister of Health. And I have to say, on a personal note, the last time we had a chance to actually speak was during the 2009 pandemic. So Dr. Frank, I hope we can get together at times other than just pandemics. It's an honor to have you here today.
Thank you, Sanjay. I'm really delighted to join this very distinguished panel. For me, this is the fifth pandemic response in which I have had or played some decision-making role. And one thing I've learned is that in a pandemic, you have, of course, the communicable disease, COVID-19, the communicable disease, but you also have a communicated disease, a disease of communication. As a trained public health physician that I am, if I were to make a diagnosis on the latter, I thought, there are four big categories. There's, of course, the misinformation and disinformation. Misinformation is rooted in ignorance or prejudice. Disinformation is actually the deliberate distortion of reality to serve an agenda of some sort. But then you also have what I would call hypoinformation and hyperinformation. Hypoinformation, typically governments will hide data, sometimes to avoid the reputational or financial consequences of revealing, for example, that you have an outbreak or a pandemic. And of course, what we've seen in this pandemic is what one could really call hyperinformation, an overflow of content, sometimes from contradictory sources, magnified by the widespread availability of information, sometimes not properly curated, that may create confusion. So I hope we'll be able to elaborate further on these different distortions that constitute the communicated disease that sometimes compounds and makes fighting the communicable disease even more challenging.
Well, Dr. Frank, thank you. It's a major topic and one that probably doesn't typically get enough attention. But unless we can solve or at least address the problem of miscommunication and discommunication, I think everything else, all the other advances suffer unless we can tackle that. And that brings us to Dr. Netta Hussain, who's a neuroscientist and also a leading Wikipedian who's covering COVID-19 knowledge. It's an audacious task, Dr. Hussain, to do this, as much information that's coming in on an hourly basis, a minute by minute basis. So just thank you for all your work, and the stage is yours.
Yes, my name is Nata Hussain, and as Dr. Sanjay introduced, I'm a medical doctor and I contribute to articles related to COVID-19 on English language Wikipedia, as well as contribute pictures to Wikimedia Commons, the free media repository of the Wikimedia Foundation. And in this panel, I'm very interested in talking about the backstage, like how volunteers came together and like processed this huge information that came on an hourly basis and made sense of it and presented it in a language that is simple for readers to understand. And this not only happened in English, but happened in over 300 language editions of Wikipedia. And it's a huge task to keep all this information updated at the same time fighting misinformation that may creep into some of our articles. So this is the aspect that I would like to focus on.
Well, again, thank you for your work in advance. Well, I'm so curious about how some of that comes together just procedurally. Dr. Elaine Nsoisi is a computational epidemiologist and assistant professor, School of Public Health, Boston University. Dr. Nsoisi?
Thank you so much, Sanjay. I'm very excited to be on this panel. My work mostly focuses on how to use non-traditional data sources from places like social media, Google searches, and mobile phones. How can we use that information to better understand public health, to better communicate, and to also understand how diseases spread? So I'm hoping to talk a little bit more about that today. I've also been very focused during this pandemic on misinformation, specifically on the African continent. I was born and raised in Cameroon, so I have a special love for Africa. And so I've mostly been thinking about that and writing about that and hope to talk about that as well.
Well, thank you. And I remember, Dr. Nsoisi, the idea that bad information can travel as quickly as the virus itself sometimes, I think is it's really important. Dr. Peter Singer, Special Advisor to the Director General of the World Health Organization. Again, thank you for your work. I can't imagine it's ever been more important. You're joining us from Vancouver, and the stage is yours.
Thank you. Thank you so much, Sanjay. And it's great to be here with you and the whole panel. I'm going to want to focus in on reaching people with accurate information through partnerships, and then the deeper values at stake, trust and justice. And on partnerships, I just want to take this opportunity on behalf of the World Health Organization to offer our respect and appreciation to all the Wikimedians for all the work that they do, including in the context of the partnership with the World Health Organization, which is shaping 5,000 plus COVID-related articles on Wikipedia in 175 languages to promote accurate information and combat misinformation. And I hope to have more to say about broader partnerships as well. But this isn't your grandfather or grandmother's World Health Organization, to quote an old Oldsmobile ad. This is one that's really pushing out accurate information in partnership through social media channels and through traditional media to reach billions of people around the world to try and improve their health and to improve the justice and equity of our fight against COVID, which is really the most fundamental issue. The three key issues in COVID that we've learned, I think, are equity, equity, and equity. And I'll leave it there and back to you, Sanjay, and delighted to be with you all.
Yeah, thank you, Peter. That's the nature of a pandemic. We're all in this together. We say it all the time, but it means something. I mean, that's something we'll certainly come back to. So we'll go ahead and start the discussion now. And again, I'll encourage anybody who wants to go ahead and put some questions, submit those. We'll try and get to as many of those as we can. But Dr. Hussain, let me start with you. Part of the reason I really wanted to do this panel today was to just sort of hear how it all works with Wikipedia. I mean, Wikipedia is obviously providing the right information, but at the same time, you have to point out misinformation. In some ways, there's a benefit, I imagine, of Wikipedia not being a news organization because you're not under the same sort of time pressures. But just tell me about how does it all work for you?
Yes, on Wikipedia, it focuses on giving slow information. So we are not as quick as the news media to like churn out information and like push it out there, but we wait a little bit longer and look at the evidence, and volunteers contribute to Wikipedia pages after after lengthy discussions on top pages of different articles. And Wikipedia also has several protections to ensure that misinformation and vandalism is kept away from its articles as much as possible. So, for example, we have a Wikipedia article on COVID-19, and it is semi-protected, which means that only registered users with a certain number of edits will be able to edit that article. And this article also has a talk page where users can discuss about controversial things, controversial parts of the article until they reach a consensus or about the scientific evidence related to that. And Wikipedia also has excellent policies related to verifiability and neutrality, which means that everything you add on Wikipedia has to be verifiable from a secondary source, and it should be neutral in content. And we also have like several guidelines about reliable sources. And these sources which do not meet these criteria cannot be cited on Wikipedia. And when it comes to medical content related to the pandemic or the vaccine, and these standards are exceptionally high. And these are some of the extra protection mechanisms that we have on Wikipedia that helps to ensure its trustworthiness. And going to the back end, we have an army of volunteers. They are not only experts, but we have people who are interested in grammar check, librarians who are interested in getting sources. We have people who are just around to ensure that the articles are copy edited. So this huge army of volunteers who work harmoniously make the Wikipedia articles like up to date and reliable. And yes, when you also mentioned mentioned about misinformation, and yes, misinformation can sometimes creep into these articles, but because of all these excellent policies, technology, and people in place, we have been relatively successful in keeping our articles free from misinformation.
Yeah, in preparation for this panel, I did go to Wikipedia and really look through the article, and I also clicked on the edits to see how it had been edited over time to get an idea of the history of this article. I'm curious, though, we are dealing, certainly if you go back to the beginning of last year, dealing with a novel virus. So there's not a lot that is known about this. What is the level of evidence? How do you think about the level of evidence required in order to be able to stay on a Wikipedia page? If someone talking about a particular therapeutic, for example, or talking about a population of people who may or may not be affected by COVID-19, how do you determine, okay, yeah, that rises to the level of evidence we require to be on the page?
We usually look for meta-analysis and systematic reviews when it comes to citing something on a medical article. These, as I said before, the standards for citing a reference on a Wikipedia article related to medicine is exceptionally high compared to, say, a biography article where it's normally enough to cite a news report or something else. So medical articles have its own reliability guidelines, and if you do not follow those reliability guidelines, the information that you add may not stick onto that article. It may eventually be deleted. And on the talk pages, we usually talk about what kind of evidence we do have about like a particular topic. So if you get a better if you have a better source, like say a systematic review or a meta-analysis to back up your back up a scientific evidence, and that would be taken into the article for consideration. So there's a lot of discussion going on about the existing evidence, and it's only the best quality evidence that gets to stick on to Wikipedia. And I'm also happy to mention that the World Health Organization has collated a lot of good scientific articles related to COVID-19, and we have been using the article tracker from the World Health Organization to pick up the best possible sources for Wikipedia articles.
Dr. Singer, I mean, she's talking about obviously some of the work that you've been involved with. And before we talk about the specific partnerships and, as you're saying, trying to reach people where they are, I'm curious about the same question, the level of evidence when World Health Organization is doing their briefings, they're putting out messaging, especially when dealing with a novel virus. If you can take us behind the scenes a little bit, how does consensus sort of get reached before a major announcement or statement will be made?
Yeah, that's a very good question, Sanjay. And it's really one of the reasons why the world needs a World Health Organization, because obviously the evidence comes in at different levels of evidence, randomized evidence, meta-analyses, systematic reviews, just like we were just talking about. But the ability to reach consensus on that evidence through advisory groups, through groups of people with representation right around the world, is actually one of the core normative functions of the World Health Organization. So it's through that kind of debate, through that kind of discussion, but through representative, inclusive, and well-governed discussions. And I think it's also important to say that evidence changes because knowledge evolves and people learn. And so that's also a real-time dynamic phenomenon. So one has to communicate not just the findings, also the uncertainty, and sometimes the change, which is some of the hardest pieces of this.
I'm curious, when you hear misinformation, and we're going to talk about the distinction between mis and disinformation here in a minute, but what do you think is fueling that? I mean, it's always sort of struck me, Peter, that we're in a pandemic. This is a terrible thing, that the world is going through. What is fueling misinformation? Do you think it's purposely or purposefully destructive?
I think it's trust. We talk a lot about information. We talk a lot about an infodemic. Actually, what we have is a trustodemic. And sometimes that trust is things like trust in government, which goes to much, much deeper issues. Sometimes it's the trust of communities. To take a very concrete example, if you're in the African American community in the United States, you have a historical context for anything that's happening, including something like the Tuskegee study. And I think that's always on your mind. And so that's why we have to think about trust underlying information, communities underlying trust. And it really highlights the importance of community leaders themselves, assimilating information, making their own judgments, and providing leadership. In some ways, leadership is what's underlying all of this, and that's the most effective vaccine against COVID. So I know I went through a number of layers there, from information, through misinformation, through trust, communities, leadership, but that's the layers here. I think that we're really dealing with, and that's why I don't really like the term hesitancy. It's kind of labeling people as being hesitant. Well, sometimes people who don't trust you have a reason not to trust you. And sometimes people who don't trust you don't really have it. So it really depends, I think, on the community and the actual concrete example.
I mean, along those lines, then you have to tailor your message, I guess, to some extent. I mean, I think you're right. I mean, just humbly speaking, that it's not a monolithic sort of thing. You have people who won't take the vaccine, you have people who will take the vaccine. It is far more nuanced than that. And that's important to acknowledge. But how does a World Health Organization then reach people, different countries, different cultures, different generations?
Yeah. So, I mean, firstly, on the side of the message, one needs the channels. And so, for example, we talked about the Wikimedia partnership. We've partnered with Facebook. It's gone to 2.2 billion viewers. With Google, 300 million searches a day, 15 million people reached through chatbots, and through something called Play a Part Together with the gaming industry, 14 billion people in 2020. That's on the promoting accurate information side. And on the removing misinformation side, 1 million videos have been removed from Facebook, TikTok, Twitter, and other platforms based on those partnerships. So part of your reach question for messaging is around partnerships. But it's not only the message, it's also the messenger. And that's why it's really important to partner with youth groups, with community groups, with all kinds of groups who themselves have to study, reflect upon those messages, decide for themselves how to contextualize those in their communities, in the barbershops, in the churches, in the mosques, in the synagogues. And that's why it's so great to be here with you, Sanjay, and with this panel, and with some people who really are very much focused on those community leaders and on those community partnerships. Pandemics start and end in communities. Leadership matters, from heads of state to community leaders. And let's really valorize the community leaders, including, by the way, the Wikimedian volunteers who themselves are showing leadership in promoting information and accurate information and saving lives.
It's a great point. And I have to tell you as well, Peter, is I have 3 teenage girls. I think 16, 14, 12, almost teenage. As much as I'd like to believe, they're never watching me on television talking about this stuff, but they are still learning. And I've been really pleased that through their own sources, TikTok, social media, whatever it may be, they often do get good information. My 16 and 14-year-old, they got vaccinated right away. My 12-year-old's now vaccinated as well. They sought out a lot of their own information, had intelligent conversations with me. So to the extent that people may be dismissive of some of these other platforms, they shouldn't be, because it's reaching, as you say, people where they are. And I got to say, Julio, Dr. Frank, as I mentioned last time you and I spoke was back in 2009. Well, I think we've spoken since then, but really had a conversation about something like this. And I remember even back then, there was a significant component of vaccine hesitancy. In fact, when I went back and looked at the data in 2009, at one point in the United States, there was about 60% of the country had some component. And to Peter's point, call it vaccine hesitancy, I don't want to paint it with one sort of brush, but people who had the reasons to not get the vaccine. It was high at one point. And they found that oftentimes it was their own community people, their community nurse, the doctor, somebody that they knew they had a relationship who was most likely to be able to provide the knowledge that they needed to make a decision on this. It wasn't necessarily as much PSAs or celebrities or TV news. It was people that they knew and trusted as a whole. But there is a lot of misinformation out there, Dr. Frank. You've seen a lot of this over the past few decades in the work that you do and as Minister of Health in Mexico. How unusual do you think is the situation right now?
There's been pandemics accompanying human history. The first recorded one in the 400s BC in Athens, and the Black Death, and the contact of Europeans with native populations in the New World. And throughout history, there's been a lot of misinformation, ignorance, prejudice, the search for scapegoats. But in recent history, although those elements of ignorance and prejudice will be present, especially because of the anxiety that an unknown pathogen creates in people and the need to find some explanation, what I have to say that I have found unusual in this pandemic, and I said this is my 5th pandemic in recent times, pandemics are accelerating since the latter part of the 20th century and the first part of the 21st century. And they are one more manifestation of the way we are abusing our planet. Pandemics are as anthropogenic as climate change. It's the unsustainable way in which we invade habitats, the way we reduce biodiversity, the way we commercialize, we raise chickens and pork. That's why we have swine flu and bird flu, the way we commercialize in these so-called wet markets. So pandemics are accelerating as a reflection of the way we relate to our planet. But in these 5 pandemics that I've had seen before, what I had not seen was the active politicization of public health and the use of, that's where you cross the barrier from misinformation, which may be the product of ignorance or prejudice, to disinformation, which is the active distortion of facts to achieve other goals, for example, political gain. And I'm very disturbed because I think part of the issue where we're lagging in our response globally, and even in the wealthiest countries, is because of that politicization of the response. It started with face coverings. It's now going into the active promotion of disinformation about vaccines. And I think this is why, I very much agree with a recent article by Yuval Harari, where he summarized the pandemic in I think what it's a very clear phrase. He said, the pandemic has shown the triumph of science, particularly in the rapid development of safe and effective vaccines, the triumph of science and the failure of leadership, and particularly political leadership. And that failure has largely been deployed or exhibited by these failures of communication. It started with the what I call hypo information. That's not distortion, that's the deliberate hiding of information, beginning with the outbreak. And I hope we have a chance to talk about new rules for the globe to emerge about timely reporting of outbreaks. Because every time a country delays the reporting because they don't want to create panic and they don't want to suffer the trade and other economic consequences of saying they have an outbreak of a disease, every time a country behaves irresponsibly, that country puts everybody else at risk. It not just happened in China originally. As the pandemic moved throughout the world, you saw in country after country leaders minimizing it, saying it's going to be gone, creating a vacuum of information that then is filled by these other sources that are not credible. And that to me has been pretty, to answer your question, pretty unusual. As you said, there's uncertainty, it's a novel virus, we're learning as we go. One thing is to acknowledge that and continue to accumulate, but it's a very different situation when in the face of scientifically validated information, like, for example, the effectiveness of the use of face coverings or taking a vaccine, political leaders actively contradict that to pursue other gains. And that's why I think the topic of this panel is so important.
You bring up there's a time when you do have a level of evidence to be able to say certain things with conviction. We now can say we know this virus can spread even through asymptomatic spread. Face coverings are important. Here's what they can do. The vaccine has a certain effectiveness. But going back to what you were saying in the beginning, when this virus is starting to emerge initially, one thing I saw, Dr. Frank, was people often will put things into a box that they understand. So you hear a coronavirus sort of starting to spread. Its source in China. This sounds similar to something I've heard before, SARS. SARS was very frightening, but it ultimately infected around 8,000 people around the world, had a 10% mortality, so around 800 people died. This is going to be SARS. Or they say, well, this is going to be a pandemic, H1N1, that affected 60 million people in the United States within a year, but had a very low mortality rate. My point is that people immediately try to contextualize something that is novel and put it in that box. They could be wildly wrong on that, but how do you sort of tackle that when you're most of us as adults really don't deal with novel things. Kids deal with novel things all the time, but when is the last time you saw something for the first time as an adult? Not very often. So how do you deal with that when you think of your role as a former minister of health, now running a big university, when you don't have all the information? You just err on the side of precautionary principle. How do you approach it?
Yes, I mean, the first thing is you need to be aware of the importance of communication. I remember when I was Minister of Health of Mexico was when we had several outbreaks of avian flu and we had SARS. And that's when WHO started promoting, I had also worked in WHO previously under Dr. Brundtland, started promoting the idea of preparedness plans. And we built into the preparedness plans, and this is still best practice, a communication strategy. It's got to be part, it's as much as, creating a strategic stockpile and having good epidemiologic surveillance is to have a good communications plan. It cannot be an afterthought. It cannot be something you start improvising once you have the outbreak. And it all starts with the timeliness of reporting. And we have fantastic international health regulations, but we have very little ability to enforce them. And so nothing happens if a country where an initial outbreak occurs fails to report in a timely fashion and puts the entire rest of the world at risk. That's been part of what's happened. We've been chasing after the virus because of the initial delay. But communication needs to be an integral part of preparedness plans. And you got to be addressing exactly that question. We're going to be learning new things, and we got to have a communication strategy, as Peter was saying, so that when new information comes on board and we need to change guidelines, instead of that being interpreted as, the government doesn't know what they're talking about because they said something different than they said 2 weeks ago, you actually explain that that's what's going to happen. And so you build what I would call the 4 C's of communication. Has to be clear, has to be concise, avoid excessive explanations. It has to be consistent. So for example, if you change guidelines as you gain more knowledge, you are explaining that that's what you're doing. And if you do those 3 things, you achieve the 4th C, which is it has to be credible. And then communication becomes your ally in fighting the pandemic instead of being the source of a lot of the negative effects that we have seen this time around.
That's really well put, and I mean, and I think Dr. Nsoisi, it sort of takes us straight to you. You mentioned, I have so many questions for you, but you mentioned in your intro about the prevalence of COVID-19 misinformation across the African continent in particular. I think we've been talking about this, from sort of a U.S. centric discussion point, but what common trends are? Does this conversation ring true to you from what you're seeing in terms of the trends in Africa? Where are people getting their information, and are they skeptical of certain sources of information?
Yeah, I think what I've seen from talking to friends and family on the continent, it's very similar to all the points that the other panelists have already made. A lot of information is coming from the usual sources like social media, from mobile apps, from news, television, radio, but you also have a lot of information coming from leaders. And in countries where people actually trust their leaders, that information is taken very seriously. So if a leader tells you there is no COVID-19 outbreak in our country, you believe them. And you live as though there's no outbreak in that country. And that can have a very significant impact on the lives of people. People can die, as we've seen in some cases, because they don't have the right kind of information.
I have to tell you, Dr. Nsoisi, I was in Tokyo recently. I was there for the Olympics, but it was a very strange sort of experience because there was no spectators or anything. It was unlike anything I'd ever seen. But one of the things I did while I was there, I had a long conversation with the vaccine minister in Tokyo, and I was talking about some of these same points that we're talking about now. And he said something to me that really struck me, which was that there is a fair amount of vaccine, and I'll use the word hesitancy just for a shortcut, Peter, but vaccine hesitancy in Tokyo as well. And when they started to really look at the social media profiles of people who were out there spreading this information, there were often pictures of President Trump. Now, this is Japan we're talking about, but there were leaders from, in this case, the United States, that they were parroting, the same messages. So the idea of a global miscommunication being able to spread so easily, we talk about the value of social media, but the misinformation can spread just as quickly. What have you seen, and what do you think can be done about that?
So one very good example is a study that came out of South Africa in 2015, and they actually show that 78% of anti-vaccination content came from the US. So it just shows you how easy it is for information to spread globally. It's really hard to stop that. I think there's, as Dr. Singh has said, there's so many efforts that are ongoing with WHO in partnership with these different platforms to stop the spread of misinformation. But there's still other ways that information still gets through, and not everyone understands that this is misinformation and they take it as a fact. So I think there's still a lot more work that can be done at the community level. We know that community interventions work. So actually having people at the community level who have been educated, who are trusted, go, whether it's door to door, talking to people, whether it's about vaccines, so that they can actually get this information from a trusted source. So there's a higher probability of them actually believing that information and getting vaccinated, for example.
Had you heard that statistic, Dr. Singer, that so much of the misinformation is being exported from a country with, not even 5% of the world's population?
I mean, it depends on media intensity. I hadn't heard the specific statistic. It's not hugely surprising. And it also shows why You have to deal with a global problem with global solutions. Gets back to your earlier question about assimilating information. People look at information differently, and that kind of global representativeness is really important on the science and also obviously on the ethics, because underlying all these issues of information and trust, the most fundamental issue is probably justice.
Let me ask you about something, Peter, that's in the news right now, and that has to do with booster shots. And I'm bringing this up metaphorically because we're in a situation where this week, maybe even tomorrow, in the United States, they will announce that booster shots will be recommended in a sequential fashion, but ultimately for pretty much the entire country. Third shots after 8 months have passed since your first 2 shots. From a World Health Organization standpoint, you talk about equity. How do you sort of address something like this? If this is happening in the United States, what does that mean for other countries around the world, and what is the message that you put out there?
Well, that's the issue. I mean, Dr. Tedros came out about 2 weeks ago, and I think, by the way, I'm a little biased, but he's really been a voice of moral clarity on this pandemic. Came and asked for a pause on boosters, at least through the fall. Why? In part on the science, because the science still isn't quite as compelling as it could be. We'll see what the data shows tomorrow. But largely on the ethics. You know, we've passed the scientific test on vaccines with flying colors, as Julio was saying. We failed the test of humanity. 1 in 2, 1 in 3 people in the United States, in the UK, and Canada are fully vaccinated. In many low-income countries, that's 1 in 100, 1 in 10 if you're lucky. And that is so self-defeating, because that's the way to make variants. The more transmission there is, the more variants they will be. People are worried about the Delta variant. Well, there's a lot of letters of the Greek alphabet left. And so that injustice, even if you don't act like you're your brother or sister's keeper, and we're not really acting like that, even if you ignore the economic arguments, and we kind of are ignoring the economic arguments, it's self-defeating to have these levels of vaccine injustice around the world, because there's a finite risk that that'll generate a variant worse than Delta that will come back and bite everybody, and we'll all have to start again. And so that's why I say justice is the most fundamental issue here, because things could get a lot better, and I hope they will. We all hope they will, but they could get a lot worse. And that's what's underlying the booster question, because the argument is people should get their first dose around the world before some people who are already well protected get their third dose. So it's fundamentally an argument from justice, but also justice that's in our own self-interest. And that's why it's so crazy to see these huge amounts of injustice around vaccines.
Dr. Hussain, so you hear that, and I'm just curious, what does that mean to you then from a Wikipedia perspective? Because there will be scientific articles that come out and say, if someone gets a third shot, they decrease the likelihood of being hospitalized by X. They decrease the likelihood of dying by X. And yet this point, in terms of what is equitable, what is moral around the world, is Wikipedia, will they lean into that sort of discussion as well?
Yeah, but let me touch upon the point of equity and justice in general when it comes to the Wikimedian perspective. So here we look at providing free knowledge to everyone, regardless of where they are, whichever geographical location they are. So in contrast to vaccines, which are like finite resources that we can give to people, Wikipedia is freely accessible everywhere. And I think this is a fundamental principle that all Wikipedians are looking at, like providing equity to everyone. And when it comes to like vaccine related discussion, I think that it's very difficult for me to predict the future of Wikipedia, because it's a collective of a large number of people who are discussing, who are looking at scientific evidence, and coming out with very beautiful discussions on talk pages, and then coming to a consensus and presenting the consensus on Wikipedia articles. So at this point, it's quite hard for me to predict how the booster dose related discussion would present itself on Wikipedia articles or its stock pages. But what I can say is that we present only slow information. We are not very quick to give out the recent breaking news. We do not have clickbaits. We do not have advertisements. All Wikipedia does is wait for a little bit and see how things work out. And when we have solid scientific evidence in like meta-analysis or systematic reviews or executive summaries from reputed organizations like the World Health Organization, we use that kind of information as citations to present that in a language that everybody can read and understand in multiple languages.
Dr. Hussain, one of the challenges I think I've had as a reporter sometimes is that sometimes policy decisions are getting made with even preprint data. Right now, even, we are hearing about some preprint data that's coming out of Israel. I'm staying on the booster conversation just because it is happening in the news right now, but it's not peer reviewed, it's not published data, and yet it's taken on a significant sense of importance because decisions are getting made sometimes on that. How would you handle that?
I think that on Wikipedia, then we would say that this country we have different articles for how different countries responded to the pandemic. We have articles on how, say, Israel responded to the pandemic and India responded to the pandemic, for example. So when it comes to these specific articles, we have enough room to describe how things worked out in the policy level when it came to, say, booster doses or vaccination in general, or other policies related to the pandemic. But when it comes to scientific articles, we keep it strictly scientific. So I think that we were really good at separating policy from scientific evidence. So when it comes to scientific articles, it's only scientific evidence. And when it comes to the other articles related to policy or the impact of the pandemic or the state of vaccination in different countries, we have that kind of information separated out into different articles where you can elaborate a little bit more about how things evolved in time.
Well, I really do applaud you for this because it's challenging. I think to navigate that, especially at a time when we're learning. I don't want to say the information's changing because that's the wrong thing. It's that we're learning, and people may perceive that as the information is changing, but it's different. Dr. Frank, I do want to ask you. You stand at this really interesting intersection, and you've seen so much. You've been in government. You're in academia. You're the president of a university. Right now, you're also in one of the states with the highest percentages in the country of unvaccinated people. How are you speaking to students this fall about safety? How do you sort of reconcile that with what the state's policies are on vaccines and masks? And I wonder, do you think of universities as a different sort of entity in all this?
Sure. This has been a challenge, but at the same time, it's an opportunity. Universities exist exactly to produce and transmit and reproduce through education knowledge. And we are guided by the principle of the pursuit of truth. We understand that truth is a dynamic, changing concept, but we have standards of truth. This is what the whole enterprise of research is based. We can judge the truth content of a statement. Again, acknowledging it's contradictory, it's dynamic, but we can still do that. So this is what we've done. We have, it's my professional field. In addition to my role as president of the university, this is something that I do, global public health. So I've been on the forefront of managing the pandemic in this university. We managed to stay open throughout most of the pandemic. Since a year ago, in the fall of 2020, we opened because we believed in two things. We believed in science. If you apply the best science at that point and into public health, you can actually open safely. And secondly, we believe in young people. It's the question of trust. And now things have been complicated by this other politicization of measures. So as a public health professional, I use all the science. And of course, we're obligated to follow the laws, and we always follow the laws, whatever they are. But we do have tools, especially in a university context, So with students, when everyone was saying you cannot open again because these are college-age students, they are not going to follow the rules, that has proven to be absolutely wrong. And we've mobilized three sources. First, what I call persuasion through inspiration. You tell people what you're trying to do, and you persuade by making the values explicit. You're going to give up some of the social aspects of college life, but for that, you will have an in-person instruction, which is going to be a rich experience for you. Second, positive peer pressure. We deployed a group called Public Health Ambassadors to exercise peer pressure. And then third, credible sanctions. If you break the rules, there are sanctions. So we continue on that. We're just about to start classes after 1 full year, and where we had 0 cases of documented classroom transmission of the virus. But it's following the science and trusting people that if you have a clear communication, you can get through this. I personally issued more than 50 messages, video messages to students and their parents throughout the previous academic year, almost one a week. It was constant communication, adapting, being clear, concise, credible, and consistent, and that gets you through. So although there are things we cannot control, like some of those restrictions, we can adapt to that by applying the science and having a clear, articulated communication strategy.
You are a former minister of health, and obviously again a president of university. Are you parts of the discussions in the state about what the policy should be? Do you advocate on behalf of the university, or is your expertise sought out?
Yes, and I do think universities have a duty to inform public debate. We need to be both excellent but also relevant. We need to be in the conversations, and we need to bring evidence to bear, both in the way people behave based on scientifically derived evidence, in the way professionals practice medicine, nursing, and in the way policymakers make policy. It's evidence-based, and that's what we produce. And we have the duty as universities to proactively translate that science into evidence that the public and the policymakers can use, and be very much part of that discussion, so that we can have a reasoned way of approaching crisis like the pandemic.
And Sanjay, if I may say, just to agree with Julio, traditional media does matter. And so, as you know, Dr. Tedros, Maria, who you've interviewed, Von Kerkhove, our technical lead, and others, they must have done at least 200 press conferences by now with the world media on a regular basis, follow-up interviews. That really does matter, the traditional media. And on the young person point, social media helps a lot. And what I would say to young people is equity is in your hands. Everybody can be an advocate. Everybody can be an activist. Everybody can be a champion. And young people are often very, very motivated to do that. And so that terrible injustice that we were talking about before, whether it's global or whether it's within communities within a country or within a jurisdiction, it's young people often using social media tools who can advocate to redress those injustices. As Dr. King said, the arc of the moral universe is long and it bends towards justice. And it's young people who keep bending it down, down, down more quickly.
Well, that does inspire me, to be honest, to hear those conversations, because sometimes it can be quite dispiriting to hear what is happening. But when I think about the next generation, it is inspiring, as you say, Peter. We have a lot of questions that are coming in from the audience, and we don't have a lot of time, so I want to get to as many of these as I can. The first question will be for you, Dr. Nsoisi. What role can Wikipedia play in addressing COVID-19 misinformation across the African continent?
I think Wikipedia has a very significant role to play, because when you think about the African continent, it's a very young continent with a median age of around 19. A lot of people there are very fascinated about social media, about online platforms. A study that we did early in the pandemic looked at searches on Google to understand what kinds of information are people in different countries looking for, specifically to identify gaps in information that public health officials could focus on. So what are people searching for on Google that maybe they don't have access to through their traditional media channels in their countries? And I think Wikipedia can have a similar role where people looking at what people are searching for on Wikipedia, what kinds of information, let's say Cameroon, for example, what kinds of information are people in Cameroon looking for on Wikipedia, and then use that as a catalyst to design more targeted communication to reach specific information, specific communities who might not have access to the kinds of information they need about COVID.
We got a question that sort of follows up on this, Dr. Hussain. This will be for you. How should Wikimedia cover the next epidemic, pandemic better? Someone's thinking ahead already. But I think the real question they're asking here is, what are the lessons that have been learned from this time around?
Yes, I think that from the experience, 1.5 year experience of like working on COVID-19 articles, I think that we really need more experts to get involved into these articles. Like Dr. Gupta has like rightly pointed out the need of like looking at evidence, and what we need is not only scientists. Scientists, but also sociologists, but also people who edit articles, copy edit articles. And so we need to expand our volunteer base, particularly our like expert volunteer base, to be able to like discuss more around evidence and discuss around how to present this kind of information to people in a very trustworthy way. Secondly, I think that we need more people to contribute not only text, but also media to articles. It may be photographs or videos or even data into our tables, the tables that Wikipedia has with updated information about statistics related to spread of the pandemic. So it's mostly the people that I think that we need to focus on so that we can be prepared for the next pandemic with our volunteers.
Peter, we got a question here that I might throw to a few of the panelists, but I'll start with you. How do you recommend the general public should evaluate information that they see in the press? I think, as you were talking about, people have the sources that they trust, but how do they know where the real information is that they should trust?
Yeah, I mean, that breaks down, I think, into the message and the messenger. And on the message side, I think the principles that Julio was talking about on the sending end also apply on the receiving end. Not everybody's going to have a PhD in epidemiology to evaluate, chi-square values in meta-analyses. But if the information is clear, if the information is consistent, if the information works in the context, that I think is going a long way. But I think in today's world, the messenger also matters a lot. And that's why the partnerships with credible sources of information, like the World Health Organization, like national health authorities, like the CDC and other national health authorities really matter. And why, at the end of the day, it's also community leaders in barbershops, in beauty salons, in mosques, in churches, in synagogues. Because I think for many people, it's the person that you trust just as much as the message. And that can be used for good or ill. But I think we have to spend as much time focusing on the messenger as on the message. And so a lot of it comes down to trust and how we rebuild trust, especially in as Julio was talking about, an environment where trust has been fractured in many countries in the world, and often trust in government, unfortunately. And that, by the way, trust in government is a marker of variations, shall we say, in cumulative mortality in countries around the world, where things like static capacity is not as good a marker as some of those dynamic leadership trust things. It's really a very, very interesting set of findings. So at the end of the day, that's what matters. That's your final outcome.
Dr. Frank, do you, I mean, you mentioned it earlier, you've seen a lot of this, but this has been politicized even in a way that you haven't seen before. And I think that goes for, as much as it pains me to say this, but news sources as well, right? I mean, people will look at a particular news source and immediately accept or expect a certain amount of bias from them, even for science-based reporters. If you add to that there is emerging evidence that not everything is known right away, it leaves a lot of room for people to immediately not trust a particular news organization, seen as too liberal, too conservative. I can't really think of many organizations now that totally get a pass in this regard. What do you think about that? What does that mean then for the average person out there? How should they evaluate an article they read in the paper, a news report they see on television?
You know, I'd like to echo something Dr. Hussain just said a minute ago. When I say it's been a triumph of science, of course, the most visible thing has been in the life sciences. First of all, the understanding, the sequencing of the genome of the virus in a few days, the rapid deployment, obviously departing from decades of basic research. It's not that the vaccines were suddenly started to be manufactured. We had that foundation. But as important as our investments in the life sciences that have led to these amazing vaccines we have, we need to do more in the social and behavioral sciences to understand that human dimension, including what determines the credibility of a source. Because today, that is literally as dangerous as the virus itself. In fact, we tend to use almost imperceptibly metaphors drawn. We talk about a message going viral. And it does, that's why it's communicable disease and communicated disease. It actually tends to reproduce in exponential ways, and we have seen this. A bad message that suddenly gains a foothold can lead to very irrational, even social panic. That's why communication has to be a key part. And I would say, as Netha said, we need to invest more in the science of communication, in understanding the way it's received, interpreted, so we can bring that kind of insight that we bring for the life sciences in producing tests and medicines and vaccines. We can bring that same kind of understanding into the way we message, and we understand, as Peter has said repeatedly, the context, the cultural context, and we can be effective communicators as an integral part of the response. If there's one big lesson on this front, on the topic today from this pandemic, we got to do a much better job of communicating and understanding the most effective ways of doing so.
You know, and I have to say as well, I had this conversation with Dr. Fauci at one point. This was a few months ago, and he said something to me that I hadn't forgotten, which is that he had read a study basically talking about how scientists were increasingly being perceived as arrogant. And it really bothered him, and it bothered me when I heard that as well. But I think it's something that we have to pay attention to, the humility, especially in the face of something that we're all still learning about, how to give good information without being overly dogmatic in this regard, I think is really important. And Dr. Nsoisi, I'm just curious if you have any thoughts on that. You know, people will read a newspaper article, they'll watch a news report. Right away, they're going to assume a certain level of bias. There aren't many honest brokers, if you will, in society anymore. What would you advise people to do in terms of seeking out information they should and can really trust?
Yeah, so I feel like the other panelists have picked up on a few really important points about, you know, having those trusted sources collaborate with news media or social media sites so they can provide accurate information. But another thing that I just want to add, in addition to humility, I think it's also compassion, which I think is something that has been missing, especially around the communication around vaccine hesitancy. A lot of the communication has been around just grouping people and assuming that everyone who has not had a vaccine, especially in the US, has not done so because they're choosing not to do so. But in a lot of cases, there's so many other factors that keep people from getting the vaccine, whether it's being unable to get a ride to the nearest hospital or not having someone to care for their children so they can actually go get a vaccine. And so I think as public health officials or researchers, we need to try to understand what people are going through and be able to communicate with them in a very compassionate way as well.
I think that's a really, really important point, and one that I try to take to heart each time. But you're right, and I live it as well. I have patients, I have friends of mine who've come to me with specific concerns, and it would be improper to sort of paint them all with one brush, as you're saying. We are already, I didn't even realize, but we're already sort of past time here. And there's still questions coming in. I hope that people will get a chance to actually interact with some of you, either through social media, otherwise. But I do want to end this possibly on a positive note. I don't want to overdo it, because I want to be honest here. But Dr. Nsosi, I'll just stay with you. What are you hopeful right now? When you put it all together in your own mind, are you hopeful? What are you the most optimistic about?
I'm most optimistic about the fact that people are getting vaccines and people will get vaccine. I just want to end with a story. I had a friend who texted me last 2 weeks ago from Tanzania, and she was asking whether it was okay for her and her parents to get the vaccine that they had available, because there was so much misinformation about vaccine. And I encouraged her to get it. And then a week later, she texted me again to thank me, because they hadn't had any side effects, and she had been so worried about all the side effects and how they would experience. So for me, that is hope that every single one of us has the ability to create change, to impact another person, to get the vaccine, and hopefully, we can have more people vaccinated in the coming months.
Yeah, absolutely. Dr. Singer, are there things that are making you hopeful right now, or are you still pretty much feeling like you're in the thick of it?
Well, obviously, we're all in the thick of it, and the tragedy is it unfolds as you watch people gasping for air, especially around the world, in Africa and other countries, is heartbreaking. But to your question, I am hopeful. Pandemics end. This pandemic will end. It's only a matter of when it will end. As Tedros said, that timing is up to us. And I often think of the words of Nelson Mandela when it comes to this vaccine equity challenge, which is, it always seems impossible until it's done. And that's why, in addition to compassion and humility and accuracy, and of course, admitting when you're wrong, and all the things that make for good followership, which is the flip side of leadership, we have to think of inspiration. And yeah, that's where young people come in. I think we need to be inspired to do a much better job than we're doing on vaccine justice. And I think we will be inspired. And I think obviously vaccines and the other public health measures, because vaccines and necessary but not sufficient, will end the pandemic. I am hopeful, and I'm hopeful based on leaders like Nelson Mandela. Again, I'm biased, Tedros, and the many people in communities that I see working hard and risking their lives to make this go away, and it will go away. So you had a question about hope. I am hopeful. It's only a question of when that hope will be realized, and that's in our hands.
Thank you for that, Peter. Julio, Dr. Frank, you've seen a lot. Are you hopeful? Is this a time for hope?
I think it is. We're not defenseless. We've been able to quickly understand the virus. There's still a lot we're learning, but the speed in which we've been learning about it, the way the scientifically validated information is spreading, thanks to a large extent to the work of institutions like the Wikipedia, which I follow devotedly and support. We're not defenseless. We have seen acts of heroism around the world, mostly through first responders, health professionals, and other so-called essential workers. We've shown that they're essential. There's been good things that have come out of the pandemic. And most importantly, I do think this has been such a devastating pandemic, unlike any of the others I had seen before, that I think it's really brought a level of awareness that we need now to capitalize on. We have a moral duty to learn the lessons. We owe it to all the people who've lost their lives and their livelihoods, everyone who suffered so much, to learn the lessons. And there's a lot of lessons. We need to build a safer world. And I am hopeful that because we had to reach this point of a pandemic of such terrible effects as the ones we're still living. We need to finish this one And the number one item on the agenda is assure vaccine justice, as Dr. Singer has been repeating. That's our first order. And I'm hopeful that leaders will stand up to that challenge and be able to meet that challenge. And then we need to make a much better job of not allowing, once the acute phase is superseded, not allowing this to disappear from our sphere of consciousness, but actually keep the pressure so that we build a safer world. And I think if we do that, this will help us with other global challenges, most important, and on top of that, climate change. And I think this has been a rude awakening, I think, for humankind. We cannot continue to abuse our planet. We do so at our peril. I do hope that lesson will be learned. And I'm very hopeful because as the president of a university, I see young people every day in action. In this campus, we've been open because young people actually were able to do the right thing, the vast majority of our students. And that gives me great hope. That young people, as we've said, will mobilize to see a much more secure. This will be the defining event for the younger generations. This will be it. I think it's going to be up to them to really make sure that those lessons get learned. So as they mature and they look forward to future generations, they build a much safer world.
Thank you for your voice, Dr. Frank, and your decades of service as well. I've always appreciated listening to you. Dr. Hussein, I hope it gives you hope that you've just heard so many things about Wikipedia and so complimentary of the work that you've been so involved with. I know I'm sure it's been laborious. I can't even imagine what your life has been like on top of the other work that you do. And I think we all thank you for it. I think you make us all better. What gives you hope? Are you hopeful?
I'm definitely hopeful. And yeah, look, by taking inspiration from the Wikimedia model, where like volunteers come together and collaborate. People don't even know each other, but they come together to collaborate to build up an encyclopedia. And in the same way, I think we can collaborate together to end this pandemic, to develop an effective vaccine against COVID-19, or to develop a potent antiviral medicine against COVID-19. And I agree to all the speakers who talked about compassion, justice, equity. And on top of that, we also need to find solutions to everyday problems like, say, combating misinformation surrounding the pandemic, providing education to millions of school children who are out of school, like creating infrastructure for internet connectivity in parts of the world where there is limited access to internet and limited access to information regarding the pandemic. So these are some of the problems that Wikimedians are looking forward to solve in the future. And I'm incredibly hopeful that not only Wikipedia, but the rest of the world will also join in the efforts to not only combat the pandemic, but also decrease the misinformation pandemic that we are seeing today.
Thank you all. I really appreciate that. Thank you. I know we spend so much time talking about spike proteins and IgG and vaccines and all that. The information and how it gets out there, I'm inspired by all of you and hopeful that we can do a good job, because I think there's probably nothing more important. So thank you all. We're about to get cut off, but let me just say thank you, and I hope the audience was able to get something useful out of it today. All of us are on social media, as you heard. So if there's more questions, please reach out to us there. Thanks for joining us.
Thank you.
Thank you.
Thank you.
Thank you.